I want to ask you something, and I want you to be honest with yourself. When you look down right now, or when you catch yourself in the mirror, do you notice that your belly has changed? Not your arms, not your legs, your belly specifically. If the answer is yes, I need you to hear this. That belly fat you're looking at may be one of the most important health conversations you'll ever have. Not because of how it looks, because of what it's doing to your body right now, underneath the surface, without a single symptom. I'm going to explain exactly what's happening, why it matters, and what you need to do about it. No fluff, no gimmicks, just the facts, and a real plan. Welcome to Daily Health Classroom. I'm glad you're here. Whether you've gained a little weight gradually over the years, had a major life change that shifted your body composition, or you've just noticed your waistline creeping up and wondered what to do, this video is for you. I want to talk to you directly, honestly, and with your actual health in mind. Let's start with what you need to understand. Not all belly fat is the same, and the difference between the two types is not a small thing. It is the entire conversation. The first type is called subcutaneous fat. That's the pinchable kind, the soft layer that sits right underneath your skin on your belly, arms, hips, and thighs. Roughly 90% of the fat on your body is subcutaneous fat. On its own, it's not what I'm worried about most. Yes, having too much of it is a problem, but it's not the main danger. The second type is called visceral fat. This is the fat that you cannot see and cannot pinch. It sits deep inside your abdominal cavity, wrapping around your liver, pancreas, intestines, and other vital organs. Only about 10% of body fat is visceral, but that 10%, that is where we need your full attention. Here's what visceral fat is doing right now if you have too much of it. It is actively producing inflammatory proteins, specifically cytokines like TNF-alpha and interleukin-6, that inflame your blood vessels, drive up your blood pressure, and damage your body's ability to manage blood sugar. Visceral fat doesn't just sit there. It behaves like an endocrine organ. It sends signals throughout your body, and most of those signals are working against you. The conditions linked to excess visceral fat include heart disease, type 2 diabetes, stroke, high cholesterol, kidney disease, fatty liver disease, and certain cancers. One large study found that women with the biggest waist measurements relative to their hip size had more than double the risk of developing heart disease, even after adjusting for smoking, cholesterol, and blood pressure. But here's something I tell every patient who sits across from me. Visceral fat is actually easier to lose than the fat under your skin. It responds faster. When you make the right changes consistently, you can start to see meaningful results in 2 to 3 months. That's not a long time. Before we talk about what to do, I want you to do one thing for me. Go get a tape measure. Not a scale, a tape measure. Stand up straight, place the tape around your bare midsection just above your hip bone, right at your belly button level. Pull it snug, not tight, not sucking in. Breathe normally, then measure. Here are the clinical thresholds you need to know, set by the National Institutes of Health. For men, a waist measurement over 40 inches signals an unhealthy accumulation of abdominal fat and a significantly elevated risk for heart disease, diabetes, and other serious conditions. For women, that threshold is 35 inches. These numbers matter more than what your scale says. I've seen patients with a perfectly normal BMI who have dangerous levels of visceral fat, what we call normal weight central obesity. The scale won't tell you that. Your waist measurement will. If you're at or above those numbers, I don't want you to panic. I want you to act. This video is your starting point. Let me be direct with you about the causes because I want you to understand the mechanics, not just the platitudes. Cause 1. Chronic excess calorie intake with low physical activity. Your body stores excess energy as fat. That is biology, not failure. For almost all of human history, storing fat was a survival advantage. The problem in modern life is that the surplus never stops, and the movement required to use that stored energy has largely disappeared from daily life. Cause 2. Chronically elevated cortisol, your stress hormone. When you're under persistent psychological or physical stress, your adrenal glands release cortisol. Cortisol is a powerful hormone, and in the presence of insulin, it actively promotes the storage of visceral fat in deep belly fat cells. Stress doesn't just feel bad, it biologically steers excess fat toward the most dangerous location in your body. This is documented in clinical endocrinology. Cause 3. Inadequate sleep. This one is not talked about enough, and I want to be very clear. Sleep deprivation is a direct physiological driver of visceral fat accumulation. A Mayo Clinic study published in the Journal of the American College of Cardiology found that subjects restricted to 4 hours of sleep accumulated 11% more visceral fat and 9% more total abdominal fat, compared to those who slept adequately. And that visceral fat continued accumulating even during recovery sleep afterward. 4 hours of sleep doesn't just make you tired, it redirects your body's fat storage toward the most dangerous compartment. Getting less than 6 hours consistently is a health problem, not just a lifestyle inconvenience. Cause 4. Diet composition, specifically refined carbohydrates and added sugars. High intake of refined carbs and added sugars drives repeated insulin spikes throughout the day. High insulin signals your fat cells to store, not burn. Over time, this pattern promotes visceral fat growth. Johns Hopkins research found that a low-carbohydrate diet produced significantly greater visceral fat loss than a low-fat diet, even when calorie intake was the same. Cause 5. Sedentary living. Your body burns fat most effectively when you move it. When you don't, particularly aerobic movement, your liver holds on to fatty acids that would otherwise be metabolized. Inactivity is one of the most consistent predictors of visceral fat accumulation across age groups. Now I'm going to tell you exactly what to do. This is what the evidence supports, and this is what I would tell you if you were sitting in a clinic with me today. Step 1. Move. Aerobic exercise is your primary tool. I need to address something directly. Crunches and sit-ups will not lose your belly fat. They will strengthen your abdominal muscles, but they will not touch the visceral fat underneath. You cannot spot reduce fat. The body does not work that way. What does work, and is clearly supported by the data, is aerobic exercise. A Duke University study comparing aerobic exercise, resistance training, and a combination found that aerobic exercise was the most effective at reducing visceral and liver fat. It burned 67% more calories than resistance training in the same time period. The current guidelines, supported by the American Heart Association and the Department of Health and Human Services, recommend at least 150 minutes per week of moderate-intensity aerobic activity. That's 30 minutes 5 days a week. Walking briskly, cycling, swimming, or anything that elevates your heart rate to the point where you can still speak but feel the effort. Or at least 75 minutes per week of vigorous activity, jogging, uphill cycling, fast swimming, plus strength training at least 2 days per week. Why strength training in addition? Because adding muscle mass raises your resting metabolic rate. Muscle burns more calories than fat does, even when you're sitting still. When Johns Hopkins researchers studied this, they found that combining even moderate strength training with aerobic exercise helped patients maintain fat loss and preserved lean muscle, which matters enormously as we age. If you are starting from zero, start with 2 30-minute walks a week. Build from there. Any movement is better than none, and the research is clear that even modest increases in activity produce real reductions in visceral fat. Step 2. Fix your sleep tonight. I'm being direct because the data demands it. If you are sleeping fewer than 7 hours per night consistently, no amount of diet or exercise will fully counteract what is happening hormonally. 7 to 9 hours is the clinically recommended range for adults. Your goal is to protect that window like a non-negotiable medical prescription, because that is essentially what it is. Practical steps. Keep a consistent bedtime and wake time. Reduce screen light 60 to 90 minutes before bed, and treat sleep as a health behavior, not a luxury. Step 3. Manage your stress biologically. Telling someone to reduce stress without a concrete mechanism is not useful advice, so let me be specific. Cortisol is the problem, and the way you bring cortisol down is through physical movement. Exercise is the most effective cortisol regulator we know of. This is one more reason aerobic activity is central to this plan. Adequate sleep, as we've covered, chronic sleep loss elevates cortisol directly, And intentional breathing and relaxation practices. Techniques like diaphragmatic breathing, progressive muscle relaxation, and mindfulness-based practices have measurable effects on cortisol levels in controlled studies. This is not alternative medicine. This is clinical pharmacology without the drug. You do not have to eliminate stress from your life. You have to give your body the tools to process it without it being redirected into your visceral fat. Step 4. Change what you eat, specifically. I will not give you a fad diet. I will tell you what the clinical evidence shows. Reduce added sugars and refined carbohydrates. Not all carbohydrates. Whole grains, legumes, fruits, and vegetables are fine and beneficial. The targets are white bread, white rice, sugar-sweetened drinks, processed snacks, pastries, and packaged foods with added sugar in the first few ingredients. Increase dietary fiber. High fiber intake is consistently linked to reductions in visceral fat. Fiber slows digestion, stabilizes blood sugar, reduces insulin spikes, and keeps you full longer. Aim for 25 to 38 grams per day from whole food sources: vegetables, fruit, oats, legumes, and whole grains. Choose lean, high-quality protein. Protein is the most satiating macronutrient. It helps preserve muscle mass during fat loss, supports metabolism, and reduces overall calorie intake naturally. Fish, poultry, eggs, legumes, and low-fat dairy are your best tools here. Reduce highly processed foods, not because they are inherently evil, but because they are engineered to override your satiety signals, are calorie-dense, fiber-poor, and drive the exact hormonal environment, high insulin, low satiety, that promotes visceral fat storage. The Mediterranean dietary pattern has the most consistent clinical evidence for reducing visceral fat and improving cardiometabolic markers. It is not a diet, it is a framework. Abundant vegetables and fruit, whole grains, olive oil, fish, legumes, moderate dairy, and very limited processed foods and refined sugars. You do not need to be perfect, you need to be consistent. I want to give you realistic expectations, because unrealistic expectations are one of the primary reasons people quit. Visceral fat, as I mentioned earlier, responds faster than subcutaneous fat. With consistent aerobic exercise and dietary changes, you can expect to see measurable reductions in waist circumference and visceral fat within 8 to 12 weeks. That is the clinical reality. You will not see it in 2 weeks. You will not see it from 3 workouts. But 2 to 3 months of consistent effort produces results that a lab test can confirm: reduced visceral fat, improved blood glucose, lower inflammatory markers, improved blood pressure. The body responds. It just requires consistency, not perfection. And the scale may not tell you the full story. Some people lose visceral fat while gaining muscle, and the scale barely moves. Your waist measurement and how your clothes fits are better indicators during the first few months than your body weight. Before I close, I want to say something that I mean completely. You did not get here through weakness or failure. The modern food environment, sedentary jobs, poor sleep culture, and chronic stress were not designed with your biology in mind. Understanding that is not an excuse, it is accurate. And once you understand the actual mechanisms driving visceral fat, you have real tools to work with. The research from Mayo Clinic, Harvard, Johns Hopkins, and Duke all point to the same conclusion. The accumulation of dangerous belly fat is reversible. Not easily, not overnight, but clearly, measurably, and within a timeline that should feel genuinely motivating. Your biology is not working against you. It is working exactly as it was designed. Your job is to give it what it was designed to run on. Now here's what I need you to do right now, and I mean right now, not tomorrow. First, go get that tape measure. Measure your waist, write that number down. That is your starting point. That is the number we are going to change. Second, identify one thing from this video that you can implement this week. Just one. Start with a 30-minute walk 3 times this week. Start protecting your sleep tonight. Start cutting one processed food from your daily routine. One change, executed consistently, produces real results. Third, come back to this channel. Every week on Daily Health Classroom, we take one health topic, the ones that actually matter, and we break them down the way a doctor would explain it to someone they care about. No clickbait, no miracle cures, real information you can use. If this video gave you something useful, share it. right now. Send it to the person in your life who needs this conversation, your parent, your partner, your friend. Because the information in this video could genuinely change the trajectory of someone's health. Hit like if you want more of this, subscribe so you don't miss what's coming next, and leave a comment below. Tell me, what's the one change you're committing to this week? I read every comment and I will reply. Your health is not a future project. It starts today. I'll see you in the next class.